Welcome back to the Next Gen NCLEX in 30, Part 2. In Part 1, we focused on understanding some of the new question formats so they wouldn't feel unfamiliar or intimidating. Now, we're going to build on that foundation. In this section, we will look at some additional formats you may see on the exam, including ordered response, select all that apply, drag and drop, and the bow tie format if it appears on your test. We're also going to practice them together. We will talk about common mistakes students make and highlight some key strategies and takeaways that can help you approach these questions with more confidence on exam day. So let's jump back in and continue strengthening your clinical judgment. All right, let's talk about ordered response questions. These questions are all about priority. On this format, you're not just picking the right answers, you're putting the actions in the correct order. And what are they really testing? Can you think like a nurse under pressure? Ordered response questions almost always focused on prioritizing actions, ABCs, safety first, what to do first, next, then. So when you see this format, slow down and ask yourself, is the airway patent? Is the patient breathing effectively? Is circulation stable? What action prevents harm right now? Remember, in real life, you don't do everything at once. You do the most critical thing first. This format rewards clear, step by step clinical judgment. Think, what will kill my patient first? What protects them from harm? What must happen before anything else? Ordered response questions aren't tricky, they're structured. And when you master priority thinking, you master this format. Let's break down this ordered response question. This question is testing one thing. Can you think like a nurse in sequence? You're given an asthma exacerbation scenario with 4 actions. Apply oxygen, reassess SpO2, assess breath sounds, administer albuterol. Now here's where students panic. They know all 4 are correct, but what comes first? NCLEX is asking you to prioritize using the nursing process and ABCs. So let's walk through it. First, assess breath sounds. Before jumping into interventions, we collect data. What do you hear? Wheezing, diminished airflow, a silent chest. Assessment guides action. Second, apply oxygen. Asthma is an oxygenation problem. Support the airway and improve oxygen delivery immediately. Third, administer albuterol. Now we treat the bronchospasm. Open the airways. Fourth, reassess SpO2. Did it work? NCLEX loves reassessment. If you intervene and don't evaluate, you didn't finish the question. Here's the correct order on the screen. Assess breath sounds, apply oxygen, administer albuterol, and reassess SpO2. Remember this framework: assessment, airway support, medication, reassessment. Ordered response questions aren't about memorization. They're about thinking step by step like a safe nurse. And when you slow down and think in sequence, you win these every time. All right, future nurses, let's talk about select all that apply. Yes, select all that apply. But this is not the old school select all that apply. This is Next Gen NCLEX style, where each answer option is evaluated individually. That means the test is no longer asking, did you get them all right? It's asking, did you make safe decisions on each option? Every single choice stands on its own. Okay, let's talk about this big idea, partial credit. So each answer option is evaluated individually. So let's say a question has 6 options. 3 of them are correct and 3 of them are incorrect. Every single choice stands on its own. If you select a correct answer, you earn points. If you avoid an unsafe answer, you protect your score. If you choose an unsafe option, you lose points. This is huge because now the exam mirrors real life nursing. In real life, every decision matters, and that's exactly how NCLEX scores you. So your strategy changes. Instead of asking, how many am I supposed to pick? Ask, is this option safe? Is this clinically appropriate? Would I feel confident documenting this? Just remember, you're rewarded for correct decisions, and you may lose points for unsafe ones. This isn't about perfection, it's about safe judgment. And when you think like a safe nurse, your score reflects it. Okay, let's go through this question. Which findings indicate hypoxia? Let's break it down. First option, confusion. Yes, the brain is extremely sensitive to oxygen levels. One of the earliest signs of hypoxia is a change in mental status. Next, restlessness. Yes, again, early hypoxia makes patients anxious and restless. Next, bradycardia. No, early hypoxia actually causes tachycardia. The heart speeds up to compensate. Bradycardia is a late ominous sign, and by that point, the patient is crashing. Last, low SpO2. Absolutely. That's your direct oxygen saturation measurement. If it's low, hypoxia is present. So your correct answers are confusion, restlessness, and low SpO2. Here's your takeaway. Early hypoxia equals restless, confused, tachycardic. Late hypoxia equals bradycardia, cyanosis, and decreased LOC. Select all that apply questions reward you for understanding the pattern, not memorizing random symptoms. Think physiology, think compensation, and you'll get these right. Let's walk through another select all that apply question. Our patient has an acute pulmonary embolism and is receiving IV heparin. The question asks, which findings require immediate nursing intervention? So ask yourself 4 quick questions. Is the patient unstable? Is there a safety risk? Is oxygenation affected? Is there a bleeding complication? Let's break it down. Sudden hemoptysis, that's coughing up blood. In a patient on heparin, this could signal bleeding or worsening PE, so this requires intervention. APTT of 68 seconds is actually within therapeutic range for heparin, so this is expected and does not require action. Blood pressure of 88/54 indicates hypotension, which could mean the patient is becoming hemodynamically unstable. That's a priority. Oxygen saturation of 90% on room air shows hypoxia. And patients with pulmonary embolism already have impaired oxygenation. The nurse needs to intervene. Mild anxiety is common in patients experiencing shortness of breath and hospitalization. It's not the immediate priority. Finally, new severe chest pain could indicate worsening clot burden or cardiac strain. So that's also a priority. So the correct answers are A, hemoptysis, C, hypotension, D, hypoxia, and F, severe chest pain. Remember for the NCLEX, you are not selecting what is simply abnormal. You are selecting what is unsafe and requires the nurse to act. Now, these are the 3 most common drag and drop formats: order response, rationale, and priority ranking. On NCLEX, for drag and drop questions, think ABCs first, assess before implementing when appropriate, and intervene before notifying the provider. Okay, let's go over this drag and drop order response. A client arrives at the emergency department with oxygen saturation of 86% and shortness of breath. Place the nursing actions in the order the nurse should perform them. Continue on the next slide. Ordered response questions test clinical priority and sequencing. Ask yourself, what does the nurse do first, second, and next? Think ABCs and nursing process. Pause to read through the options and put into the correct order. This is the correct order. Improve oxygenation by raising the head of bed. Assess the patient by assessing the respirations. Implement treatment by applying oxygen. Reassess the patient. So you're going to reassess the SpO2 and then notify the provider if needed. All right, let's think like the NCLEX. This drag and drop format tests clinical reasoning. You are identifying the problem and the evidence supporting that problem. The nurse recognizes the client is at highest risk for what? You have three options: impaired gas exchange, fluid overload, or infection. Now ask yourself, what is the most immediate threat to life? Then connect it to the cause: low oxygen saturation, elevated white blood cells, or peripheral edema. Pause here and decide, then continue to the next slide. Okay, let's break it down. The correct answer is impaired gas exchange due to low oxygen saturation. Why? Because oxygenation is always priority. Low O2 means the body is not getting what it needs to survive. This is immediate and life threatening, not infection, not fluid overload. Airway and breathing always come first. That's how you prioritize, that's how you pass NCLEX. Next, we have priority ranking. The nurse is caring for 4 clients. On the next slide, place the clients in order of priority for assessment. These questions test prioritization, which is a huge part of the NCLEX. Use the ABCs rule. Airway and breathing problems come first, followed by circulation issues, then other concerns. Read through the options and place in order from highest priority to lowest priority. This is the correct order. Oxygen saturation 88%, blood glucose 60, temp 100.4, pain 8 out of 10. Let's talk about one of the newest formats on the Next Gen NCLEX, the bow tie question. It's called a bow tie because the layout on the screen literally looks like a bow tie shape. On the left side, you identify the patient condition. In the center, you select nursing actions. And on the right side, you identify what you should monitor to evaluate the outcome. So, this question is testing clinical judgment from start to finish. In this example, the patient has sudden shortness of breath, absent breath sounds on one side, tracheal deviation, and low oxygen saturation. Continue on the next slide. Those are classic signs of a tension pneumothorax. So first we identify the condition. Next, we choose 2 priority nursing actions. For a pneumothorax, the nurse should apply oxygen and prepare for chest tube insertion. Finally, we choose the parameter to monitor. If the intervention works, we should see improvement in oxygen saturation. So these are the correct choices on the screen. So this one question tests whether you can recognize the problem, act, and evaluate the outcome. And that's exactly how nurses think in real clinical practice. All right, if you remember nothing else from this session, remember this slide. This is how you think on NCLEX. Just 4 questions. Number 1, what's the problem? What is actually wrong? Is this oxygenation, perfusion, infection, bleeding? Name the problem clearly in your head. If you can't identify the problem, you can't fix it. Number 2, is it acute? Did this just happen? Is it worsening? Is this a change from baseline? Acute changes move to the top of your priority list. Number 3, is the patient stable? Look at airway, breathing, circulation, and LOC. Stable patients can wait. Unstable patients cannot. And finally, number 4, What keeps them safe? This is the big one. Which answer prevents harm? Which action protects airway, prevents bleeding, avoids complications? NCLEX is not asking, what do you remember? It's asking, can you recognize risk and keep this patient safe? So every case study, every select all that apply, every matrix questions, run it through these four filters. What's the problem? Is it acute? Are they stable? What keeps them safe? That's clinical judgment, and that's how you pass. All right, let's talk about why students miss questions. Not because they don't know content, but because they make these common mistakes. First mistake, ignoring patient data. NCLEX gives you labs, vitals, history, trends, and students skip it. They jump straight to the answers without asking, what is this data telling me? If the potassium is 6.2, that matters. If the oxygen saturation is 84%, that matters. If LOC has changed, that matters. The data is not decoration, it's the clue. Second mistake, picking provider orders first. Just because a provider ordered it doesn't mean it's the priority. NCLEX is testing nursing judgment. Sometimes the safest action is hold the medication, clarify the order, or assess first. Third mistake, forgetting nursing scope. If the answer requires diagnosing, prescribing, or performing outside or in scope, it's wrong. NCLEX loves to test this. So stay in your lane, assess, monitor, educate, intervene, evaluate. And the big one, overthinking. Students talk themselves out of correct answers. If the patient can't breathe, support airway. If they're bleeding, control the bleeding. If they're unstable, act. Simple, safe, priority-based thinking wins every time. So here's the takeaway. Use the data, think like a nurse, stay in scope, don't complicate what is simple. That's how you avoid NCLEX traps, and that's how you pass. All right, pause for a second. Take a breath because I need you to hear this. You've got this. The Next Gen NCLEX is not designed to trick you. It's designed to reflect clinical thinking. And guess what? You've already been practicing that. Every clinical rotation, every care plan, every time your instructor asks, what's your priority? That was NCLEX training. You've done this. Second, you are not expected to know everything. Let me say that again. You are not expected to know everything. Safe nurses don't know everything. They recognize problems, they prioritize correctly, they protect patients from harm. That's what this exam measures. Not perfection, not photographic memory, not random trivia, but clinical judgment. So when you sit for this exam, don't think, do I remember every detail? Think, what's the problem? Are they stable? What keeps them safe? You've trained for this, you've practiced this, and you are more ready than you think. You've got this. Before you go, I want you to take this with you. Passing the NCLEX isn't about memorizing thousands of facts. It's about learning how to think like a nurse and building strong clinical judgment. And that's exactly what the Next Gen NCLEX is designed to test. To help you continue studying the smart way, I put together a couple of free resources for you. You can download the NCLEX Study Tips Guide, where I break down strategies to help you approach questions with confidence. And I also created a Next Gen NCLEX cheat sheet that summarizes the key concepts we talked about so you can review them quickly while you study. Both of these are completely free, and you can grab them using the link in the description below. If this session helped you understand the Next Gen NCLEX a little better, make sure you like the video, subscribe, and share it with a friend who's also preparing for the exam. Future nurses, you've worked hard to get here. You've got this, and I'm rooting for you. I'll see you in the next video.